Hi, I'm Vicki Westling with City Speaks. City Speaks is a show that's brought to you by Mayor Rosas and his administration to make the residents of Dunkirk understand or to know what's going on in the city, what's going on around them, let you know if there are things happening that are important or that are vital to you. And today we have two very special guests with us. We have Lauren Ashburn and we have Jose Quinones here with the Alzheimer's Association. We're going to talk a little bit about Alzheimer's, what it is, some of the symptoms, what can we do. We're going to talk about the caretaker, things that we can do for caretakers. So please tune in. I know Alzheimer's affects many, many lives and many families throughout our area. So this is a really important show. So thank you so much for coming.
Thank you.
Thank you.
Thanks for having us.
Well, we're delighted to have you. Alzheimer's is really one of those things that people talk about, and yet they really don't understand it fully. And one of the questions that I have and that people always talk about is the difference between Alzheimer's and dementia. Tell me, what is the difference between the major differences between Alzheimer's and dementia?
And there is a difference.
Yeah.
A lot of people think that they're the same thing all the time, and they're not. So Alzheimer's is actually just a type of dementia. Dementia is that umbrella term. So much like the term cancer, if you're talking to somebody and they say they're diagnosed with cancer, you're going to ask what kind, what type, where is it affecting? That's exactly how Alzheimer's is. Why we hear about Alzheimer's the most is because it affects people the most. So for every diagnosis of dementia, about 60 to 80% of those diagnoses are caused by Alzheimer's disease. So Alzheimer's is just a form of that dementia caused by the short-term memory loss.
Okay. All right. So the Alzheimer's is a short-term memory loss. So now if I have someone who's beginning to exhibit signs of confusion, they're elderly, does that necessarily mean they have Alzheimer's?
No. And you don't have to be elderly either. And that's a big myth out there too, is that people that are younger than 65 don't get this disease, when there's over 200,000 people living with younger onset Alzheimer's before the age of 65. But there's two kind of distinct differences we talk about. We talk about aging, and then we talk about the Alzheimer's problematic changes. As we age, our bodies age with us. So that means our brain.
Unfortunately. Right.
But that also means that our brain ages with us too. So we're going to see some typical changes that happen, maybe missing a monthly payment once in a while, our judgment becoming off sometimes, forgetting a name. It takes a little bit longer to recognize that face. Those are all normal. Losing your keys and kind of remembering where, retracing our steps, normal. It's those 10 warning signs that we talk about that are more problematic.
Okay, now you talk about, the forgetting of names, and there are a lot of people who just don't remember names. And that doesn't necessarily mean they have Alzheimer's.
You're right.
But if they forget names that they should know very well, like when their son or daughter or come into the room and they can't quite figure out who they are again. So would be a difference, right?
Definitely. And there's so many different symptoms that happen too. Not everyone exhibits the same symptoms at the same time.
Let's talk about some of the symptoms. Yeah. Okay, the first one we talk about are the memory loss that disrupts daily life.
So you're recognizing that some of the familiar tasks that happen throughout the day that you find so easy, it's just kind of automatic, like autopilot, those are becoming a lot more challenging for you. So for example, I work with a lot of people in the early stages of this disease, and a lot of people also assume that people aren't aware of the symptoms at first. When you're in the early stages of the disease, you are completely aware of the changes that are happening to you. So for instance, we work with one gentleman who was really struggling at work. So he was diagnosed with younger onset Alzheimer's, but he was telling somebody one thing to do, is he was in a management position, and then he was telling somebody else a completely different thing, and then both of them would come back and say, this isn't right. And he wasn't recognizing that that was happening.
Okay.
So it was just something so familiar and so easy for him that he's done for years that was becoming challenging.
All right, and so things like that would happen. So it's not just a matter of, gee, you know, where did I put my glasses this time? You know, it's a matter of really doing things that you would normally do. We also talk about planning or solving problems. So, and that's one of the symptoms, that, you know, things that become challenges. Tell me a little bit about that.
So that has a lot to do with our executive functioning in the brain. So a lot of times when we think about planning, we know that our doctor's appointment is 3 weeks out, and we can plan for that. Now, for a person with Alzheimer's disease or exhibiting those early symptoms, that becomes a lot harder to remember that appointment is 3 weeks out. They can't, it's really difficult to also make decisions. So if you've ever sat at a restaurant and you know how overwhelming the menu is, just for us with healthy brains, it's really overwhelming. Now, for a person living with Alzheimer's disease, that's too much. It's so overwhelming to the fact that they can't even make those decisions off the menu. They get so overwhelmed that a lot of the times the person with Alzheimer's wants to leave. And so it's kind of that withdrawal piece that happens too.
And you talked about completing familiar tasks, and those would be the things like, you know, taking laundry out of the dryer and folding it. They would forget, you know, well, what do I do with it now? That sort of thing. And then, of course, confusion with time and place, you know, the disruptions. And so when I've seen individuals who have Alzheimer's, and suddenly you move them from one room to another, and they're totally disoriented. They're unable to do that. So is that typical? Is that one of the signs that probably is more prevalent?
Definitely. And we also see, as the disease further alongs, we talk to caregivers all the time that say, I don't know what to do because my loved one says that they need to go home, but we've lived here for 30 years. And we talk to them about that their memory is going further and further back. So they're not recognizing this 30-year-old home. They're recognizing their home from 40 to 50 years ago growing up. So it doesn't make sense to them. Like, we have to jump into their reality.
I remember my mother-in-law used to tell, she was in a nursing home, and she was suffering from, at that time they called it dementia, and she would say, you know, I used to come down that road in that black car, but I don't remember where I was going. You know, and we would have to remind her, oh, well, you were going to this one or to that one. But, you know, those little things that come back. So, so that happens. And then problems with speaking or writing, forgetting what you're doing.
Well, it's also understanding conversations, too. When you think of a conversation, like we're going back and forth right now, that's actually a lot to process in our brains. So for a person living with Alzheimer's, it takes a lot longer to process information. So in one back and forth, if I'm asking you 3 different questions, or I'm telling you a long story, they might still be stuck on that beginning of the story or the very end. So when they're asking you the same question again, it's not because they just forgot and didn't listen to the story. It's because they had that hard time processing. But it's even confusion with words in jumbling their words too. Using descriptors more than the actual word itself. So saying, oh, you know, Jose, I really like that hand clock you're wearing, instead of the actual word for a watch. They're using those descriptors more.
Okay, and so you know, you see that the sort of thing that does happen. One of the things that you do at the Alzheimer's Association is that tell me about the services that you provide. What kind of services do you provide to the Alzheimer's patients, and then of course to the caretakers?
Yeah, we provide a lot.
Caregivers.
So in New York State right now, there are over 400,000 people living with Alzheimer's. That's a lot of people. That means that there are over 1 million of those folks caring for those living with Alzheimer's. We are called the Alzheimer's Association, but we do serve all types of dementia. That's not very well known. There's a lot of folks living with different types of dementia that aren't Alzheimer's, like FTD and Lewy body. We service all those folks.
Okay, now what is FTD?
FTD. It's a frontotemporal dementia. So it really affects the front parts of our brain first, and it typically is diagnosed younger onset. So before the age of 65. So it's judgment, mood and personality changes, really difficulty with that language and some of those behaviors that are changing in the brain. So sometimes it's not so much those early memory signs, it's something that's completely off in the judgment impairment section of the brain. That's more rare. But it's still, I see a lot of folks living with FTD too.
Okay.
But we do serve them as well. But as a whole, we provide care and support to everybody affected by dementia. We have support groups. We have a 24/7 helpline that they can call any day, any time, any night, doesn't matter. It's a holiday, they can still call.
Okay, what is the number for the helpline?
It's 1-800-272-3900. And please call us.
Okay, 1-800-272-3900.
3900.
That's the number.
Yes.
So 24 hours a day, 7 days a week.
And we also partner with our local offices for the aging. So in Chautauqua County, we partner with the Chautauqua County Office for the Aging, and we can provide some funding for respite services. This is really exciting.
Tell me a little bit about the respite services.
Yeah.
Absolutely.
So respite just means a break. And some of these respite services that we can provide funding for, it's short-term or kind of emergency funding right now. It's honestly the first time we've ever been able to partner with the state in this way. So we receive state funding to provide these services. So they can access adult day services, bringing in-home care into the home, or even sometimes they can offer an overnight respite stay. So if somebody wants to take a vacation, like that is so needed, we may be able to provide some funds for that as well.
So the respite services really would help with the caregivers, because
Definitely.
the caregivers really struggle.
Yes.
I mean, there's a lot going on there when we talk about the caregivers, you know, and I can imagine that you would become very impatient at times and be very difficult. Tell me, at what point, and if you're a caregiver, at what point do you say it's time to move Dad somewhere else?
Yeah, that's the most difficult decision a caregiver could ever go through. And it's a personal one too, and that's something that we can also help with. So we can be there to talk the family through that decision. It's not an easy decision, and it's not something that is made with a light heart. A lot of times it's that safety aspect. So the person is wandering outside the house all the time, and the caregiver is still working full time, and they can't be there that 24/7, that 24/7 supervision that's needed with this disease. So safety and that care on the caregiver. So if the caregiver isn't getting that respite, that break, a lot of times we see that the caregiver will have a lot of health problems themselves that may cause them to need to place their loved one, because they can't care for them if they're not caring for themselves either.
Right. So, I mean, I would imagine that would be a pretty heartbreaking decision. Jose, you're fairly new to the Alzheimer's Association. You're from the Dunkirk area, so you're pretty well known. Tell me a little bit about what your role is and what you have decided, why you decided to do what you're doing.
Well, thank you. Again, thank you for having us, Vicki. I'm going on my third week with the Alzheimer's Association, going through a lot of training. Yes, I'm from this area, Silver Creek / Dunkirk. And my title is a community outreach specialist. My job is going to be to bring about awareness. I will be working with the Office of the Aging. Awareness to me is so big. It's just getting that information out there, letting people know that there are services, that there is help for them. When you find yourself in that position that you think that there's nobody there for you, we are there for you. Why did I make the move from what I was doing? It's about giving. It's a way of me giving back to the community. In this role, I will be working with all 8 counties of Western New York, but primarily I'll be doing a lot of work here in Chautauqua County and making sure that I partner with organizations. Another role of mine is going to be, volunteers. We need volunteers to help us grow the Alzheimer's Association. I wish I could do it all by myself, but it's proven that not one man can do it, or one woman. So we need help. We need that help to help us bring out awareness to to our people, and to let them know that we are there for them.
Right. Okay. Well, good. Well, we're glad that you're doing what you're doing, and certainly
We are too.
So that's great. And so now you'll be working with the senior citizens, the senior citizens areas here in Dunkirk and in Silver Creek. Is that correct?
Yes, all over the county. I'll definitely focus on the rural parts in Jamestown. And like I said, also the other 8 counties that we have in Western New York, I'll be definitely working. But I'm hoping to work with Ms. Corwin at the Office of the Agent. Definitely make those connections with the adult daycare centers here that we have here, as well as hospice. You never know.
Right. God, thank God for hospice, really,
Correct.
Truthfully. Well, you're going to be a busy man.
Yes.
Yeah.
There's lots of work to be done.
So tell me a little bit, what is the mission behind the Alzheimer's Association?
So we are committed to care and support for anybody affected by dementia, especially Alzheimer's too. But we have a huge component of research too. So a lot of people ask, if I want to donate to this nonprofit, where does my money go? It goes directly to the folks that need it. So we are at the forefront of research right now. It's actually really exciting. We've never had so much money in NIH funds through the federal government too. We're at about $2.1 billion in funding for research, but we're really focused right now on lifestyle factors and how you can hopefully prevent an onset of dementia. We're not there yet, but it's really an exciting time, and a lot of our money in our organization goes to research directly.
And now I've just seen recently on the news that there is a new drug that they're testing that's actually helping to reduce because the plaque in the brain. So hopefully that will be out. They're saying that's a year away.
It's really exciting. We haven't had a drug that has gone to phase 3 that has actually shown that the cognition is affected. Usually it's just the symptoms that it helps, but this is actually saying that the cognition is helped. We're hopeful, but it's not a sure thing, because the phase 3 is really when it goes. A lot more participation is in the trial, but it is hopeful. It's not totally promised, but very hopeful.
Well, that would be wonderful if we could find something to help with that, because Alzheimer's is really a tragic disease for everybody that it affects. So now let's talk a little bit about that. We've talked about poor judgment. We've talked about some of the other symptoms, but one of the ones that I have seen is that they withdraw. And you mentioned that when they said, well, like going into a restaurant, they withdraw. But they just really withdraw from society and even from family members. So if an individual who has Alzheimer's doesn't have to be diagnosed with all 10 of the symptoms.
No.
Is that correct?
Nope. Typically when somebody is showing symptoms, we tell them to definitely start journaling them down too, because that just helps the doctor in the diagnostic process. Typically people go to their primary first to talk to them about it, but you can also go to a neurologist. That's who's really going to do that diagnostic testing. But withdrawal, that is one of the biggest symptoms that we see. Social isolation is significant in this disease. But if we're talking about it and we're experiencing these symptoms and it's such a stigmatized disease, that's where that withdrawal can happen. And it just gets really hard to follow conversations. And we're able to filter out everything. When you think about it, when we're at a restaurant talking about that situation again, there's the waitress coming over, there's a million different conversations at the table if you're with a huge group, and then you have the other tables that are having those conversations. There's a lot going on, and we can filter that out and focus on the person that we're talking to next to us or across from us. For a person living with Alzheimer's, it's not easy to do that. They don't have that filter ability. So that's when going into public places becomes a lot harder, because there's just too much going on. So that's why we see the withdrawal too. But some folks feel really embarrassed and ashamed when it's really the brain that's doing this to them. So it's not something to be embarrassed or ashamed about, but in our society there's such a stigma.
And now there's another question that I have, is that if an individual becomes more aggressive, for instance, like if they've always been not necessarily aggressive, but fairly willing to respond to adverse situations. Let me put it that way.
Yeah.
But then now you find that, they're driving a vehicle and they're shouting and giving the finger and things that you'd say, well, they've always been a little bit, on that side, but now they're really getting bad. Is that something that you should concern yourself with?
Those mood and personality changes can definitely be a sign. There is also a stigma with this disease that if you get the disease, you're just going to either turn into this very sweet person or you're going to be this very aggressive person, and that's just not true. A lot of the times, and I talk to a lot of caregivers about this and volunteers, that every single behavior that we see from a person living with dementia is really a form of communication. Because their communication is so lacking with this disease, it comes out in those behaviors. So say somebody suddenly starts getting aggressive and they hit their caregiver, we also have to look at what prompted all of this. What was the trigger in this situation? And that's something that we talk to caregivers with all the time.
Okay. So really, it's not just when you see somebody suddenly becoming more than what they were.
Unless it's really, significant, because that can be a sign with the mood and personality changes for Alzheimer's, and especially that FTD type of dementia that I talked about. So if it is concerning to you, then go with your gut. That's what I always say too. If something feels off, it probably is off. So it's best to nip it in the bud, because maybe it's not an Alzheimer's or a dementia diagnosis. Right. It's something going on internally, like a vitamin deficiency or a urinary tract infection. We see that all these different things can cause symptoms of dementia too.
So
to get more complicated on you.
So just because somebody's acting out doesn't mean they have dementia. They may have some other issues. So as a family member, what should the family member do if you say, come on, Mom, I know you're really struggling, let's go to the doctor. And she says, I'm just fine. I don't need to go to the doctor. I'm just having a bad day. Should the family member contact the doctor and say, hey, I think Mom's having more than a bad day?
Yeah. This is the story that we hear all the time. That's probably our most common question that we get. How do I get my loved one to the doctor? Especially if they're in denial of their own symptoms.
Sure.
A lot of the times we talk about pairing it with something they actually enjoy, not telling them 2 weeks in advance that, hey, we're going to go see a neurologist in 2 weeks, because they'll focus on that and they're not going to need it. Sometimes it's really being that supportive person. You know what? I'm concerned about myself. I want to get some testing done. Will you come with me? I'll feel better if we do it together. But it's also just having that open dialogue and calling us so we can brainstorm all those different options too.
Okay.
Yeah, that's exactly what we do. We try to help the caregiver and the person living with dementia too, in any journey that they're on, because it's a journey, that's for sure.
When it comes time to put the patient, mom, dad, husband, wife, whomever, to remove them from the home and put them into a nursing home or whatever it may be, do you help with that placement?
So, good question. We don't help in the sense that we call the facility and get them a room and things like that, but we do have a whole list of facilities in the area, so we can provide that referral for them and we can help guide them along that process. But no, we don't provide that case management where we could go do that for the family, but we could also refer out to a case manager that can help with that.
So your facilitation would begin and end with these are the places that you could go, these are your options, what I might do, and I'll help walk you through the process of making the decision, but then the case manager must take over. So that's very good to know. Is there anything that we need to know from the onset? You're saying you need volunteers. What would a volunteer need to do or need to know in order to volunteer for this association?
Have a heart.
Well,
and one to give back.
I think it's still beating.
And one to learn from it. Again, it goes back to that awareness piece. And we talk about caregivers, and you never know when you're going to be in that position to be a caregiver. And I think that is so important with Alzheimer's, because you just never know when that person may be in that position to be helping a loved one. But volunteering, you know, we can use help in tabling events. We can use help with education. And again, it's just getting the word out, within the community.
Okay, so volunteers, when you talk about tabling events, that means when you're going to have make a presentation at a senior center or a community event. So you would have volunteers to help you set up or to help work with those types of things, passing out pamphlets, getting information. Is there, as we go through this, so in addition to being a referral, to being a supportive group, if you wanted to volunteer as someone who actually worked with the patients or worked with the families, there would have to be some qualifications involved. Is that correct? So what might those be?
So we have so many volunteers, it's wonderful. We need more though, especially in Chautauqua. Sincerely, we need a lot of volunteers in this area because we're really trying to outreach more. We know that this disease affects so many folks that we can't do it alone, like he said earlier. But a lot of our volunteers are past caregivers themselves. So, for instance, a lot of our support groups are run either by professionals, like social workers or therapists that are in the field, but a lot of them are run by former caregivers that have already gone through that entire process and have cared for a loved one, and they want to give back to the community, and they want to give back in a way that can help the rest of the families that are affected. So they can facilitate a support group, they can teach classes. We have a lot of former teachers that just went through training, that retired teachers that will be out teaching classes in the community too. But if you're interested in being a volunteer, we'd love to have you, because then we can talk about where would be a better fit.
Right, so you don't have to have a special skill. You just have to like you say, have a heart, have compassion, a willingness to volunteer, and then you will help place them into the right niche, if you will. Now, let's talk just a brief moment about the support groups for the caregivers, because there are so many caregivers who say, you know, I don't need it. I'm fine. I can work on this through my own. You know, I'm better off by myself. I do a lot of reading. I can make this work. How do you get that caregiver to come in and embrace them into the support group and let them know that they are not alone? How do you do that?
Yeah, it's difficult. A lot of the time it's coaching them through that whole process of it's time, because it's self-care. If you've been on an airplane, I'm sure, and you know that oxygen mask, you have to put the oxygen mask on yourself before you can help that next person. So that's what we talk to the caregivers about. You need to be able to take care of yourself so you can better care for your loved one and provide that care that's needed. And some of that, in a way, is getting that support from a support group. And we talk about the benefits of a support group. Going to a support group, meeting with other caregivers, not only are they going through a similar situation, but say you're having a difficulty with your loved one that somebody's already gone through, and they can give you tips and they can give you tricks, because you need to get creative as a caregiver. But that's what some of those groups can provide to them too. So again, we walk through that entire process with them.
So,
and to add to that, Vicki, that's part of that outreach part. Even if they don't want to go to a support group, the fact that they know that, you know what, Jose is going around. Jose gave me his card 2 weeks ago. It's just that one time that they may be so overwhelmed that they'll decide to make a call to us.
Yep. And we can even meet in person too. So if they aren't comfortable in a support group setting, like he was saying, we can come to the home, we can meet in the community, anywhere. We are happy to meet at any time that they need and just have that one-on-one sit down.
So one of the things with the association with Alzheimer's is that not only do you provide the respite care, but also you provide the coaching, the counseling, the outreach, and the support groups for the people who may be suffering as well. This has just been so exciting. We could go on for another 30 minutes, I'm sure. I'm sure. Thank you so much for being here. This is really very important. Please, if you have any questions, any comments regarding Alzheimer's, if you have loved ones who are suffering from the disease, or if you yourself think, gee, I might be having some of these symptoms, call
1-800-272-3900.
Very good. And thank you. Thank you for watching City Speaks. City Speaks can be seen daily at 3 o'clock and 10 o'clock on Spectrum 1301 in Dunkirk. You can watch it anytime by going to DunkirkAccess.com YouTube. If you have questions, concerns, comments, let me know. Send an email, vwestling@cityofdunkirk.com. Send a snail mail, Vicki Westling, City Hall, 342 Central Avenue, Dunkirk 14048. Give me a call, 716-363-6888. Thank you. Thank you so much for watching City Speaks. And don't forget to vote. Thank you. Bye-bye.
Thank you.